The main event of UFC 282 is off after Jiri Prochazka suffered what UFC doctors are calling the worst shoulder injury they've ever seen. Welcome back everybody, I'm Dr. Brian Sutterer, and if you're new here and enjoy learning about the underlying anatomy and mechanisms of different sports injuries, then please consider subscribing to stay up to date with all future videos. I think this came as a surprise to everybody, so I want to try to dive in and help you understand what these injuries might have been. In this article with Yahoo Sports, Prochazka's manager, Tim Simpson, was quoted as saying that the shoulder got wrecked in a standard wrestling accident type of thing. Dana White went on to say that, quote, "This is the worst shoulder injury the doctors have seen in UFC history. It's really bad," which is quite a significant statement. He's going to have serious surgery, and that'll of course require extensive rehab. A little bit more detail here from Simpson saying, you know how shoulders are. Basically, it pops out, and a lot of the time you pop it back in. There was a weight, and it popped back out. You never really know with the shoulder until you dig into it. So it sounds like Prochazka suffered a very severe shoulder joint dislocation, which in and of itself is a very common injury that we'll see in combat sports, especially with grappling and wrestling. But the fact that Dana White is saying it's the worst the UFC doctors have ever seen is definitely on the extreme end of that injury, and not something that I would have necessarily expected, especially in just of a training scenario. To me, that implies this goes beyond just the standard labrum tear that you have with a dislocation. If you look at our biodigital anatomy tool here, I've shown the muscles and tendons of the rotator cuff. There's 4, and they basically wrap around the head of the humerus, or the ball of the shoulder socket, to help control its movement and sort of stabilize the shoulder up against the socket called the glenoid. It's very uncommon for somebody who's young to have a rotator cuff tear when the shoulder dislocates, but when you get older, a rotator cuff tear is more likely. So scenario number 1 is that he possibly had a torn rotator cuff tendon along with the shoulder dislocation, which would certainly make this a more significant injury than something like we saw maybe with Brian Ortega or recently TJ Dillashaw. Of those rotator cuff tendons, it's typically going to be the one on the top called the supraspinatus or the one in the front called the subscapularis that are likely to be torn with these types of injuries. If we hide the rotator cuff tendons, then deep to that we can see the labrum. Now, the labrum is the structure that's most often injured, very, very high percentage of shoulder dislocations. Basically, the labrum is this little rim of cartilage that goes around the socket of the shoulder. Whenever the shoulder dislocates, the ball of that humeral head shifts forward and basically shears across that tissue of the labrum, leading to a tear. When that labrum is torn, there's less capability for that ball to stay in place, and so your shoulder is more unstable and more likely to pop out. One other possibility that could make this more significant is something called a bony bank heart. Basically, whenever the ball of the humerus pops forward, along with shearing part of the labrum, it can actually knock a chunk of bone off of the socket, off of the glenoid. If this is a significant enough defect, usually around 30% of the surface area of that glenoid, then we'll have to do surgery to basically pin that piece of bone back in place. You can also suffer fractures of the humerus with these dislocations, most of the time not requiring surgery, but of course with what Dana White is saying, who knows how bad this might have been and how extensive these fractures could have been if they're there. The final piece of this is a possible nerve injury. There's one specific nerve called the axillary nerve that wraps around the humerus right in that area where the shoulder is going to dislocate. The axillary nerve is responsible for sensation on sort of the outside of the shoulder and innervating some of the muscles in the shoulder. Certainly, if this nerve gets injured with a shoulder dislocation, it might be something that requires surgery to actually graft that nerve back together, which would be probably on the most extreme end of the spectrum with severity here. But it's possible that Prochazka has some type of nerve damage, making this a more significant injury. The supposed mechanism of doing just some standard wrestling types of things makes sense as well. Oftentimes the shoulder dislocates anterior, meaning forward relative to the socket. So if you're wrestling, if somebody's pulling on your arm and pulls it forward and your muscles can't stabilize it, then it can dislocate. The fact that it's such a significant injury with what presumably seems to be a lower impact type of mechanism with just a practice session is definitely surprising to have read. And of course, Dana White is known to exaggerate things, so who really knows what exactly happened? The best example of this that I could describe is basically what happened with Brian Ortega, where you could see as he tried to pull up, his right shoulder basically got pulled downward as he was trying to get up from this submission attempt. And of course, his shoulder dislocated here. So I don't know if this is something like what might have happened with Prochazka, because this mechanism with this wrestling position can certainly lead to a dislocation as it did with Ortega. There has to be more here than just the standard dislocation and labral tear, because surgery for that is typically not going to be a year plus recovery. A lot of UFC fighters have had shoulder surgery for similar types of injuries and have come back and wrestled just fine, so that in and of itself doesn't make me concerned about Prochazka's career. But again, this unknown of it supposedly being the worst the UFC doctors have seen Opens all these possibilities for things like nerve injury, significant fractures, rotator cuff tears, all these other possible injuries that can go along with a shoulder dislocation, aside from just injury to that labrum. That's it for the video, everybody. Let me know down below any questions or comments as always, and until next time, we'll see you later.